Hello everyone, I'm Sam, your host here at the Senior Golden Cafe, where we break down famous medical studies into simple, everyday language. Thank you so much for tuning in. Today we're going to talk about something incredibly important, your blood pressure. Did you know that after the age of 60, the rules of our bodies completely change? A number that might have been dangerous for you at 35 could actually be perfectly fine at 75. And today, I'm not just going to tell you this fact. I'm going to walk you through the actual clinical trials that completely changed how cardiologists around the world think about this. So lean back, get comfortable, and let's dive in. Listen close, everyone. Your arteries are not made of steel pipes. They are living, breathing tissue. When you're young, they move with incredible flexibility, just like a brand new garden hose. They absorb the heavy shock of every single heartbeat and soften the pressure before sending it out to the rest of your body. But just like anything else in this world, as we age, that elasticity begins to fade. Over the decades, the walls of your major arteries, especially your aorta, slowly start to stiffen. Collagen builds up, and the elastin fibers that give your arteries their bounce begin to wear out. And here's the truth. This is something that happens to almost every single one of us. Now, here is exactly why this matters for your numbers. Every time your heart contracts, it sends out a massive pressure wave. In a young, flexible artery, that wave gets cushioned perfectly. But in a stiff, aging artery, that pressure wave travels at lightning speed, bouncing right back to the heart during the contraction instead of the relaxation phase. As a result, as we get older, your top number, the systolic pressure, tends to climb, while your bottom number, the diastolic pressure, usually stays the same or actually drops. It's a completely different biological game. We have a name for this exact setup where that top number spikes while the bottom number stays totally fine or dips a bit. It's called isolated systolic hypertension. And guess what? It's not some strange medical anomaly. It is actually the textbook #1 form of high blood pressure in the over 60 crowd. If you fall into this age bracket and a doctor tells you your pressure is running high, you can bet your bottom dollar it's because of this very pattern. And guess what? There is one more bonus number that most people have absolutely no clue about. It's called pulse pressure. Simply put, it's just your top number minus your bottom number. For example, if your blood pressure reading is 150/70, your pulse pressure is 80. Now here's the science. When the gap between those two numbers starts to widen like that, it is a direct, unfiltered reflection of how stiff your arteries have become. Even if your top number looks okay on the surface, if that pulse pressure gap is consistently wide, staying at 60, 70 or 80 plus, you absolutely need to flag that for your doctor. Hold on a second, everyone. I know pulse pressure might sound like medical jargon to a lot of you, so let me break it down real quick. From now on, when you check your blood pressure, please stop looking at just a single number like 120 or 140. Instead, I want you to focus on the distance between those two numbers. If that gap stretches past 60 and keeps getting wider, that is your blood vessels literally shouting a distress signal saying, "Hey, I'm getting way too stiff over here and I'm struggling." Let me give you a quick example. Say your blood pressure reads 120/80. You do the quick math and your pulse pressure is 40. That right there, perfectly normal, textbook healthy. But now let's say your reading comes back at 150/70. Suddenly, that gap jumps all the way up to 80. Folks, that is a major warning sign. That is your body sending out an SOS. Alright, here is where it gets really interesting. We are going to look at 4 key clinical trials that changed everything. Following the timeline of this research will show you exactly why the blood pressure advice you get today is a whole different ballgame compared to what your parents were told back in the day. Let's look at the data. First up, we have the landmark HYVET Trial, which stands for the Hypertension in the Very Elderly Trial. Now, this incredible study looked at patients aged 80 and older across 13 different countries with an average baseline blood pressure of 173/91. The researchers split them up. One group was treated with a target goal of getting below 150/80, while the other group received a placebo. And folks, the results were so staggeringly clear that they actually had to stop the trial early. Why? Because treating these seniors aggressively cut their risk of stroke by a massive 30% and slashed all-cause mortality by 21%. Think about that. We are talking about folks over 80 years old. The HYVET trial proved once and for all that even our oldest loved ones benefit immensely from treatment. But here is the critical detail you need to notice. They set the target at 150/80. The researchers deliberately chose that number because they knew just how delicate and vulnerable the body can be at that stage of life. Next up, in 2015, came the game-changing SPRINT trial, the Systolic blood pressure intervention trial. Now, this study asked a completely different question. It wasn't, should we treat it? But rather, how low should we actually go? They took thousands of adults, including folks in their 60s and 70s with a high risk of cardiovascular disease, and split them into two paths. One was the standard group aiming for a target under 140, and the other was an intensive treatment group aiming all the way down to under 120. And just like before, the data was so overwhelming that they had to stop the trial early because it would have been unethical to keep going. According to the data published in the SPRINT trial, the intensive group saw a staggering 25% drop in major cardiovascular events and a 27% reduction in all-cause mortality. And here is the kicker. A sub-study focusing purely on adults aged 75 and older showed that these incredible benefits held perfectly true, reducing cardiovascular events and death rates by about 33% in that specific age group. But wait, it gets even better. A sister study called SPRINT Mind revealed that this intensive blood pressure control was also linked to a significantly lower risk of developing mild cognitive impairment. Mind-blowing, right? That is how crucial blood pressure management is today. Managing your blood pressure right now might literally be the very thing that protects your precious memories tomorrow. Then, in 2021, we got the incredible data from the STEP trial, the strategy of blood pressure intervention in the elderly hypertensive patients trial conducted over in China. Published in the prestigious New England Journal of Medicine, this massive study followed more than 8,500 patients between the ages of 60 and 80. They wanted to compare an intensive target group aiming for 110 to under 130 against a standard group looking at 130 to under 150. And guess what? The intensive group saw a significantly lower rate of cardiovascular events. We are talking 3.5% compared to 4.6% in the standard group. But here is the most fascinating part. Researchers directly tracked the stiffness of the patient's arteries over time. They discovered that consistent intensive treatment was directly linked to dramatically slowing down the progression of that arterial stiffening. It's like putting the brakes on the aging process of your blood vessels. So, when you look at the big picture, the HYVET trial tells us, hey, for the very elderly, a target of 150/80 is both safe and highly beneficial. But on the flip side, the sprint and step trials suggest that for younger, healthier seniors, aiming even lower can do a world of good. This exact tug of war in the data is precisely why medical guidelines can never be a one-size-fits-all solution for everyone. So, what is the ultimate takeaway from all this data? The American College of Cardiology and the American Heart Association took a hard look at HYVET Sprint and a mountain of broader evidence. Because of that, they lowered the definition of high blood pressure to 130/80, recommending that healthy, independent seniors should aim to keep their top number under 130. But remember, the HYVET trial still stands as a powerful reminder. For our most fragile and elderly patients, a more relaxed target of 150/80 is proven to be genuinely safe. This is exactly why some international guidelines choose to keep a more conservative standard for those over 80. It's not that these experts are arguing over the data, rather, they are simply weighing a different delicate balance. The vital balance between preventing a stroke and protecting a vulnerable body from being pushed too hard. Folks, if there is one thing I need you to lock into your memory, it's this. If we aggressively drop the blood pressure of someone whose arteries are already stiff, we run a serious risk of triggering something called orthostatic hypertension. Now, that's just a medical term for that sudden dizziness you get when you stand up and your cardiovascular system can't react fast enough. But for a senior, that split second of dizziness can be the exact line between a normal, peaceful day and a devastating fall that shatters a hip. It happens that fast. To be completely honest with you, the research in this area is heavily mixed, but thankfully, both the sprint and step trials specifically tracked serious adverse events, like actual falls and severe low blood pressure. And what they found was reassuring. Under the careful watch of a doctor, the intensive treatment group didn't face a significantly higher risk. When done right, under proper supervision, you don't have to trade a hip fracture for a stroke. But doing it right is the ultimate key here. We have to closely monitor the individual patient, looking at the actual person in front of us, not just blindly chasing numbers on a monitor. Now let's put this into action. First, invest in a high-quality upper arm home blood pressure monitor and make sure you measure with the exact same posture every single time. Sit down, keep your feet flat on the floor, support your arm at heart level, and rest quietly for a solid 5 minutes before pressing start. Second, track your pulse pressure regularly and keep a close eye on whether that gap is starting to widen. Third, bring these numbers to your next doctor's appointment. Sit down with them and ask, looking at the ACC/AHA guidelines and trials like sprint and step, where exactly do I fit in? Should we keep my target relaxed like the HYVET patients, or would I benefit from a lower, more intensive goal? And fourth, if you ever feel dizzy when standing up, you absolutely must report that. Remember, how you feel is just as critical as the numbers on that screen. Remember, you are not just a number on a medical chart. You are a complete, beautiful human being. And these numbers are just pieces of a much bigger, more profound personal picture. Our goal here isn't to breed fear or scare you. It's to empower you and your doctor to work as a team, protecting your heart and your brain, while making absolutely sure you keep the strength, safety, and stability you need in your daily life. It feels like almost everyone we know these days is managing high blood pressure with medication. So please, just as these studies show, keep checking your numbers every day and take great care of your health. Before we wrap up, I want to leave you with something straight from the heart. Everything you heard today, HYVET, sprint, step, and the ACC/AHA guidelines, is meant to empower you to ask better questions at your next visit. It is never, ever meant to replace the judgment of your doctor, who knows your medical history, your lab results, and you as a person better than anyone. No radio host, no matter how well-intentioned, can be the final decision maker for your personal health. So take what we discussed today, write down your questions, and bring them to your physician. The real answers are found in that face-to-face conversation. Stay healthy, everyone, and I'll see you next time. Thank you.